In America today, we're having quite a bit of problem with a synthetic opioid called fentanyl. I'm a board-certified anesthesiologist, and we use it in the operating room all the time during surgery to alleviate pain when you're having the operation. But we're having problems now is a lot of the drug dealers are actually mixing fentanyl with heroin. So a patient will use their normal heroin dose, not knowing there's fentanyl in there, and then what they end up doing is overdosing and dying. Fentanyl is a synthetic opioid that is 100 to 125 times as potent as morphine. So it's extremely dangerous medication, not used properly and in a controlled setting by obviously a medical professional. Another thing we're having problems with in the United States is I think it was in the 2006 or so, a lot of pills were coming in from Mexico. Those pills looked like hydrocodones. They looked like Lortabs, Norco, and things like that. But these drug cartels actually have machines that are able to punch out pills that look like Norco, hydrocodone, Lortab, but they're actually fentanyl. So people would buy off the street Lortab, and they would take the medication, and unbeknownst to them being fentanyl, and they would overdose and die. The federal government was actually able to track that down to one specific lab in Mexico and shut it down. But in the meantime, there's been a whole bunch of labs that are in China that have been doing the same thing. So now we have a big rise in the Midwest, actually all over the country, but it's specifically in the Midwest, where patients are buying medications off the street and are counterfeit medications, and are actually taking fentanyl, which, like I said, is 100 to 125 times as potent as morphine, and then them overdosing and dying. So fentanyl is a huge problem. It's much stronger than heroin, and people are dying, unfortunately. So I think we need to really address the opioid epidemic kind of like four parts. The majority of the problem is the actual physicians. Physicians are overprescribing of opioids. They're not getting patients, finding the underlying etiology or problem and actually getting treatment for them. And they're not following stepwise approach. It should start with muscle relaxants, anticonvulsants, non-steroidals, things like that. They're going straight to high doses of opioids. So number one is educating the physicians, and number two is we need to work with law enforcement. Pharmacies. The pharmacy should be able to question the doctor why he's prescribing these medications in such high doses. And the last thing is the patient has to also take responsibility for their treatment. But when it gets out of hand, family members need to be able to come to the doctor and say, hey, what's going on here? What's the explanation for this? And what can we do to help mom or dad get better? So there's a four-facet approach I think we can do. Number one, educating and stopping these doctors from prescribing excessive amount of opioids.